training seminar workshops already on the new way of caries diagnosis and assessment. So that's the ICDAS. So as early as next month, there will be activities already on educating the oral health professionals, including dental students, on the message that caries is a continuum.
For sugar, fluoride, and universal access. I think for sugars, we need to seriously look at sugar as a risk factor to many things, obesity, diabetes, and other non-communicable diseases aside from dental caries. And the need to really look at labeling of food or making sure that already available policies such as the no beverage policy in schools are really implemented. For fluoride, the issue is always, at least for the toothpaste, which is the most available to the public, and which would address to some extent universal care. The challenge is always how do we provide appropriate and affordable fluoride to the public? And thereby appropriate, we're looking at cost, quality, and safety. So that may include more than one agency. But the advocacy would need to be an engagement by the oral health sector to the other agencies. Universal health care, we cannot do without the curative part. If we just focus on the preventive without looking into the curative part, that's not going to work. So there must be a system that would allow most of our people to have access to health care, and that would mean inclusion of oral health benefits within the field health system. But unfortunately, we forgot the field health. So, yun. Plus, preventive packages within the field health. That is something we need to work on still. I give back the floor.
Dr. De Leon will answer the question on the visions.
Thank you very much. First of all, I would like to acknowledge the presence of our very competent and reliable partner, Dr. Anthony Calibo of DOH. And of course, one of the members of the PADC, Dean of Davao Medical Science Foundation, which has a very strong community dentistry program, Dr. Gary Mativer. I think one of the positive outcome of this advocacy is that it's really a good, big paradigm shift when it comes to delivering care. First of all, I would like to differentiate between dental mission and dental civic action. Dental mission is providing care to a place where there is no road or zero access of care. That we are all still doing it. But for urbanized areas where there are also community dentistry, we have to change the way we deliver care. But it will be more heavy now on preventive aspect of the care delivery. In fact, that will also change the image of dentists. We will no longer be known again as Dr. Bunot, but rather partners in total health, in empowering members of the community to take care of their own health through a good, viable preventive program, dental preventive program. So I think this also should be communicated to the public and the LGU, no? So baka kasi sumama ang loob ng publiko na pupunta yung dentista, hindi sila bubunutan. We will be there to educate them that there is still hope on those teeth, no? Na hindi lang bunot ang sagot sa tamang kalusugan ng pagdental. So we will empower them to education, no? And hoping that we will never go back to their place again to extract the teeth. No? So these things should be communicated both on the LGUs, the DOH people, and of course the public. It will now be a good, positive paradigm shift. Thank you very much.
I'd like to add a little to the universal healthcare question. The estimates 2011 showed that only 30% of Filipinos have access to the services of a dentist. So 10% would go to the private dentist, 10% would go to the private dentist, 20% to the public health dentist, and 70% have no access. And the number one reason, of course, is economics. So I have some good news. The Department of Education and PhilHealth have started talks on covering the preventive services of children. The UP College of Dentistry also, and together with the National Institute of Health, has submitted a proposal to PhilHealth for PhilHealth to basically do the same thing, cover preventive services. Maybe we can ask Dr. Ella for the latest on the talks between PhilHealth and the DepEd.
Well, first and foremost, just like the Department of Health, the Department of Education is 101% fully supporting ACFF also. The reason why is that there is research evidence that indicates that yes, dental caries is the top cause of absenteeism in school. There is also research evidence that said that with dental caries, it's not only curing doing something about absenteeism, it's also increasing children's ability to focus for whatever the teacher is teaching in class. So yes, we are fully supporting the ACFF program, through strengthening of our current programs that is being done in school, and this is that we do believe that health education alone is not enough. We need to mold our children to develop good habits. And for them to develop good habits, hindi lang po tayo magtuturo ng health education. We have to let them do the activity in school for them to develop yung hand washing skills and toothbrushing skills. So yan po yung ginagawa na po namin sa eskwelahan. The other package that we're talking about, na sinasabi ni Doc Vic, is that we are in coordination with the Department of Health, Dr. Calibo and Jen. We are proposing for PhilHealth to finance health programs to be done in school, and that is the provision of toothbrushes and toothpastes and soaps. So yun po yung ginagawa nila for the daily toothbrushing and daily hand washing in the school. So it's still in the process of coordination. Hopefully, PhilHealth will be amenable to the proposal that the Department of Education is proposing.
Thank you.